All right, ladies and gentlemen, let's start the second round of the CPR competition. Now again, we will have 3 teams whom we invited. But let me introduce the judges first. We've got Anne Lippert from Denmark. We've got Diana Cimbescu from Romania. And we've got my co-chair, Mr. Robin Davis from the UK. So I will ask the first team, the wonderful ladies from Turkey, to come and join us on the scene. Please give them a big round of applause.
May I go?
Mustafa.
Ready?
Handan.
Are we ready? Yes? No? Some slight technical problems with one of the mics, ladies and gentlemen. Just give us a moment.
Ne yapalım? Mikrofon takıyor.
Okay.
Okay?
Okay.
Right then, who's team leader?
I am.
Hello.
Hello.
So I'm going to give you a scenario, and I'm
Okay.
going to get you to repeat it back to me.
Okay.
You'll then have a moment to prepare your team, and then I will ask you if you are ready to start.
Okay.
Once you say yes, the scenario will start.
Okay. Thank you.
Okay?
Thank you.
So, you've been asked to see Donna urgently. She is 60 years old. She is complaining of chest pain. She attended the hospital, sudden onset shortness of breath and right-sided chest pain. She has been treated in the past for breast cancer with tamoxifen.
Okay.
Do you understand the scenario? Do you want to repeat it back to me?
Oh, yeah.
Tamoxifen.
She's Donna is taken to the hospital with the complaint of chest pain.
Yes?
And he is also suffering from breast cancer. And
Yes.
she has shortness of breath.
Yes?
Yeah, that's it.
Okay. And treated in the past for breast cancer
Yeah, I
with
saw.
tamoxifen.
She's
Okay,
She
good.
has it.
Okay. Do you want to brief your team?
Okay. Okay.
Okay. Are you ready to start?
I'm ready.
Please do.
Okay. Donna, how are you?
There's no response,
No. Okay. Is there any pulse?
and there are no signs of life.
Okay. No pulse? Okay. Take the patient on the floor, please. Hadi. Start CPR. You have to do 30 and 2 ventilation for that. Please monitorize the patient. I want to see the patches.
1, 2.
You have to open the IV access. Open the IV access. It's okay. Okay. May I see the monitor?
One.
May I see the monitor, please?
I will go on.
Okay. Give him some fluid. Please take some blood for the sample or investigation. I think he has a cardiac problem. Please include
One,
on it the cardiac enzymes and hemogram also. I need that, and electrolytes also. Okay.
1, 2.
Okay.
It's monitor, is it?
Okay, it's Wi-Fi. We have to do defibrillation for him, for her. Please organize the monitor and defibrillation. We have to give our shock. First shock will be 150 joules. Okay.
I am charging.
Take the oxygen away. Compression.
Oxygen away.
Go on compression and shock, please. Give shock.
Shock.
Start compression again. Go on, compression. Don't stop. Could you please intubate the patient?
Yes.
Intubate the patient.
Listening.
Okay. Continue CPR. We have to give the second shock now with the maximum energy. Are you ready? Charge the defibrillator. Take the oxygen away. Continue
I am
CPR.
charging.
Oxygen away.
You will give shock now. Stand clear. You can give shock. Just stop compression.
Yes.
Okay, continue compression now. Okay. We have to do 2 more minutes. Don't look to patient. Don't look to defibrillator. And continue CPR, please.
And tidal carbon dioxide.
İkinci şu. Üçteyiz. Entidal karbondioksit. Nurcan devam etsin.
Go on. Don't stop.
Damar yolu bunu. Give me IV plan. Give me crystal.
I want to check the... Okay. Do we have capnograph? Can you use it, please?
I touched the
think-
carbon dioxide.
I want to listen to the lungs again.
It is the 15.
This.
Okay. 2 minutes is over, so she needs a third shock. Please arrange it with the maximum energy. Okay.
Yes.
No, is it
Maksimum enerji.
maximum energy? Yeah. Please, yes, implement it. Take the oxygen away. Continue CPR. No, bu ritim değil. Etme.
Okay.
No. Go on, continue CPR. Continue CPR, don't look to defibrillator. Continue ventilation. 1 milligram of adrenaline you have to do and 300 milligrams of amiodarone after the third shock.
Ritim nedir?
We have to continue CPR, don't look to patient. Okay, it's done. Give it some fluid, flash the fluid after the drugs.
Ritim böyle arkadaşlar.
Okay, 2 minutes is over. I have to assess the patient again. Oh, there is a rhythm on the monitor and there is an organized rhythm and I have to check the patient. Is there any pulse here?
Yes, there is
Is there
a
any
pulse.
Oh, good.
Yes,
good.
there is a pulse.
So I will assess the patient, re-evaluate the patient again. Is he conscious? Is she conscious?
Not conscious, no.
She's breathing with the ventilation. I think there is no problem. Is there any problem with the
A, B,
size
C,
and
D, E
lungs?
again.
Okay, there's equal air entry. There is no spontaneous breathing.
Okay, maybe we can ask for the echocardiography for that patient.
Yes.
And what's the respiratory rate?
There's no
Just
spontaneous
under
breathing.
control of what? Okay. What's the heart rate? It's 103. What's the blood pressure?
Blood pressure is 90 over 40,
And capillary filling time?
5 seconds.
4 seconds. So, what's his temperature? Blood temperature.
Temperature's 37 degrees.
Okay. Let's. Does he respond with the pain or verbal reaction?
response.
No response. Please, I have to exposure. Is there any findings?
Nothing particularly abnormal to note on exposure.
What is
Okay.
SO2?
So now I need a chest X-ray for her. I asked for the echocardiography and also cardiac enzyme. She's on breast cancer therapy, so she may be a problem with the chemotherapies. And I need to see electrolytes
Yes.
and cardiac enzymes. I remember I wanted that.
It is lung.
And all blood samples, maybe cross match.
And metabolic
For
disorder.
the blood abnormalities. And I also need 12 leads ECG I'm thinking about the cardiac problem. What's the potassium level?
Potassium's normal.
Normal, okay.
And-
I need to ask for an expert. I need to call the cardiologist.
Okay.
If I diagnose it, elevation on the STs, I need their help, and maybe I really have to take him to the percutaneous coronary
I understand.
intervention, or maybe.
Going to bring the scenario to a close there. Round of applause, everybody.
Hipotermiyi konuşalım.
So, for the debriefing, you look all sweaty and you work very, very hard. So, congratulations on that.
Yeah, as an old ladies.
No, I don't think so. So, tell me, are you satisfied with your performance?
I think we were not so bad. We are good, but we did some implementations. Maybe we might be late for that, but the result was good because she had a spontaneous circulation.
Yeah, that was
she,
good.
She's living now.
Yeah.
And I want to add just something that this is a really interesting coincidental event for me because I'm a breast cancer survivor.
Pardon?
I am a breast cancer survivor.
Okay.
And it's a really interesting coincidence. Yeah.
Yeah, okay. So, almost too exciting, actually. Yeah. So, what went especially well?
Okay, I think I organized the team
Yeah.
very good. I think
Yeah.
like that.
So the kind of choreography was good. That you all knew your places and what to do. Yeah.
Every minute
Thank you.
we change the compression.
Every 2 minutes we
I
change
saw
the
that
compression.
every second time you
And,
changed who was compressing.
We organized equipment as well, monitor and
Yeah.
The serum set, and also we use capnograph for the correct ventilation and breathing, and also we want to be sure about spontaneous circulations if it's coming or not.
Yeah. So I noticed a couple of problems.
Okay.
One of them was when you were going to shock the third time.
Okay.
You stopped the team because
I couldn't be sure about if it is fibrillation or not because the amplitude was large. I was confused if it is real rhythm or not. It was.
yes. And did you check the pulse then?
No, because I'm not sure. It
No.
was.
So you just
it looks like
continued.
it's a
But it was a
fibrillation.
case of PEA, so
Yeah.
you did right that you continued chest compressions.
Yeah.
But in a PEA, you should also give some medicine. Do you remember what kind?
Adrenaline.
Yeah. And
Yeah.
so I think
I
you
just-
missed that one.
Yeah. I
After the
I
first
was just couldn't be sure about if it was I think it's a technical or mind problem. It was ventricular fibrillation or PAA. Or
Yeah.
I couldn't.
But
But
otherwise,
you're right.
after the third shock,
Yes.
also if it had been ventricular fibrillation or tachycardia, you should also give adrenaline.
Yeah.
Yeah.
I did 1 milligram of adrenaline.
You did?
Yeah, and 300 milligrams
Okay.
of amiodarone.
We didn't see that. I don't think we heard it. So you did give it.
I'm sure I did.
Okay.
1 milligram of adrenaline and 300
Okay.
milligrams. Sorry. Yeah.
Okay, good.
Thank you.
I also noticed another thing. You put the patient on the floor. So is that to have better access and more effective
We
compressions?
couldn't be sure if we could do effective on bed because we are not sure about its hardness and etc.
Okay.
So we want to compress the patient in a real good depth, 5
Yeah.
and 6
But then
centimeters.
you encountered a problem with the IV
Yeah, it was late.
that you couldn't connect it to the fluid. Yeah. So
Technical
sometimes
it's-
you have
yes,
one
Sarah,
problem and
you're right.
but the compressions are probably more important than IV fluid at this point.
Yeah, thank you.
So,
You're right.
yeah.
Thank you very much for the criticizing.
Okay.
Yes.
And another thing, when there is a PEA or even during the cardiac arrest, we normally go through the reversible courses.
Yeah.
Yeah, I didn't hear any of that.
I just asked the moderator for the potassium levels, and
Yeah.
I just thought about the coronary problem, and I wanted the cardiac enzymes, and maybe there could be a problem about due to chemotherapy, and maybe electrolyte problems and
Yeah.
etc. I
Yeah.
was just told about it, but
Yeah, but you did not voice them as
okay. Maybe I
H's
can
and
list
T's.
them. Yeah, it will be
Yeah.
better to list them. Yeah,
Yeah.
you're right.
So you talk, but I think you talked quite a lot to your team and had a very good and clear leadership of the team.
Thank you.
Absolutely, yeah.
Thank
Okay.
you. Thank you
Thank
very
you.
much.
Thank you very much.
Thank you. Thank you.
The second team of the second run of the CPR competition is due to come to the stage. Please welcome the team representing Finland.
Let's get the wooden box. They need the wood. Right then, ladies and gentlemen, who's
Okay.
team leader?
I'm the team leader. Yeah.
Please step forward. So I'm going to give you a scenario. I'm going
Okay.
to ask you to repeat it back to me so that I know that you've understood it.
Okay.
I'll then ask you if you're ready to start.
Okay.
When you tell me yes, that's when the scenario will start.
Okay.
Understood?
Understood.
So you've been asked to see Donna.
Donna.
She's 60 years old.
Okay.
She's complaining of chest pain.
Okay.
The pain came on suddenly, and she was also short of breath,
Okay.
and is on the right-hand side of her chest.
Okay.
She has been treated in the past for breast cancer with tamoxifen.
Okay.
Do you understand? Do you want to repeat that back to me?
Yeah. So are we in a hospital or is this
Yes.
a hospital
Yeah.
environment? Okay. We're called to see Donna.
Yeah.
And she is 60-year-old patient, and she has suddenly complained of chest pain and shortness of breath, and the chest pain was on the right side of the body. Am I right? Okay. And she has previously had breast cancer.
Correct.
Yeah.
You ready to start?
Can we take a look at the bed first?
I can give you 1
rapidly?
minute to do
1
that,
minute,
yeah.
okay.
Miten tää päät liikkuu?
Siis nukkemaahan ei aleta edes vääntää, on mun mielipide.
Okay.
Meillä menee ikuisuus, että me saadaan nää alas, deffa ei mahu mitkään. Ei
Miten se
KV,
laita?
puolet tulee painelu.
Miten laita lähtee? Tää on ihan nostettavissa, mutta... Miten se laidan saa siitä pois? Toiselta puolelta. Santtu. Niin siellä, joo.
Mistä sinä lähdet?
Sama tällä puolella.
Niin se oli siellä. Joo.
Tää lähtee ihan nostamalla tästä, päästään sen kanssa.
Hei, meitä on tässä näin nyt sanottu, että on mukaan 4, se on sekunnissa tuossa maassa. Tätä sänkyä ei tarvitse siirtää.
Joo, tehdään sille. Tehdään sille. Oh. Joo, saadaan deffa paikalle. Joo. Joo. Yes, we are ready. Okay. Hello?
Okay, go.
Are you awake?
No
Come on,
response.
wake up.
No response.
Okay. 1, 2, 3. Can I feel the air move?
There is no breathing and
Okay.
there is no
Can I
palpable
feel-
pulse.
No pulse. Okay. No chest rise. Okay. She's in cardiac arrest. Please help me lift her to the floor. Osmo, start compressions.
Yes.
Amanda, please attach the defibrillator pads.
Defibrillator pads.
Okay. And Timo,
Yes.
please take care of the airway.
I'll take care of the airway.
And we are going to do 30 compressions, 2 ventilations, till we get her intubated. Okay.
I'll take care of the
Yes.
intubation.
And we're going to do a rhythm check as
One.
fast as possible.
2. One, 2.
Okay, Amanda, are you ready?
It does not take sign from the paddles.
Okay, can we get some data from the paddles?
There's Yuri. There's Yuri.
4, 3, 2, 1, 2.
Are they attached
Paddles
properly?
attached, but it doesn't give a sign.
Okay.
Should I put the IV line?
Yes, Anssi, you can start the IV line. Please take a blood sample also.
Blood sample, yes.
Ready for rhythm checkout.
Okay, we're gonna do a rhythm check.
2.
Osmo. Stop compressions. Continue compressions. Okay, we have VF, which is a shockable rhythm. Amanda, please charge 200 joules.
Charging.
And when ready, lead a safe defibrillation. And after that, you can continue the CPR.
Okay. Clear.
Clear. Start compressions. Osmo, please help Timo with the intubation.
I help.
Yes. And Anssi, you're going
Yes.
to take care of the time. So
Yeah, I
keep
was
track
running.
of the time. 2
Yes.
minutes. Yeah, thank you.
Yes. Continuous compressions. Yes.
Do we have any relatives present? Anyone here? No. She's all by herself. Okay, thank you. Do we have any previous knowledge of her besides the facts that you told me?
Only what I've told you already.
Only what you told me, okay?
Okay, I'll hang it up right now.
IV line ready, okay.
Yes, IV
And
line ready.
Anssi, we have a VF, so no drugs at this time.
Okay, no
We'll
drugs.
see how the situation develops.
Yes. Santtu, tube is in place.
Okay? We're gonna check that if the tube is in the right place.
So there is equal bilateral air entry.
Equal, bilateral, okay. And do we have capnograph on?
I do
With
have
capnograph
capnograph.
Yes,
also.
capnograph is on.
On, okay.
Yeah.
And Amanda, continuous compressions from now
Continuous
on.
compressions.
Okay, thank you.
And the vena sample ready for analysis.
Vena sample ready for analysis. Okay. How much time do we have?
30 seconds left.
Okay, 30 seconds.
Yes.
Thank you. Okay, we're gonna start going through the 4 H's and 4 T's, the reversible causes of the cardiac arrest in a while. We're gonna do a rhythm check first, and we're gonna go through those after that. So, okay. And during the rhythm check, Osmo, please feel for the pulse, and you're gonna continue
10
CPR.
seconds.
10 seconds. Okay. Amanda, stop compressions.
I can feel.
Start compressions. Okay, we have a VF still, which is a shockable rhythm. So Amanda, please hard charge. I think we can use 300 joules.
300.
300 this time, yeah. And when ready, lead a safe defibrillation.
Okay. Clear.
Clear. Start compressions. Okay, let's go through the 4 H's, 4 T's. So the patient has complained of chest pain and shortness of breath, and it has all started very rapidly. And she has been here in the hospital, and she has had a breast cancer previously. Okay, so hypoxia, there seems to be nothing to suggest that. There was no airway blockage or anything like that.
The chest
Right.
wall is moved equally bilaterally. Zero
Okay,
entry.
yeah, so nothing to suggest that, but of course it can be possible if there's thrombosis, for example. But
Yes.
yeah, nothing. But we're treating a hypoxia. Hypothermia, she feels warm and we're inside, am I right?
Yes.
Yeah, okay, probably not hypothermia. Do we have the blood sample ready? Do we have potassium readings?
Where did you send your blood sample?
We took a blood sample, and I
Sent it
think
to the
if
lab?
we have a EPOC or ISTAT kind of a blood gas analyzer.
Point of care test.
Yeah, point of care tester. Yeah, yeah.
Potassium is 5.
Potassium is 5. Okay, so it's on the high end, but not that much. Okay, probably not hyperkalemia. Okay, hypovolemia. Is there any major bleeding? Can we see anything like that?
There's nothing obvious.
Okay. Tension pneumothorax. The breathing sounds were bilateral.
Yes, they were.
Okay, they were bilateral, and no tamponade, probably also no trauma behind this. Okay, toxins. I think we can't see anything, any drugs lying around, anything like
Nothing
that.
to suggest that.
Okay,
that
nothing
it's
such that. Okay, thank you. So thrombosis, that's probably our main cause. She has been in bed and in hospital, so
And previously chest pain.
Chest pain, okay, so there can be thrombosis in the heart or in the lungs, so embolus, yeah, that is possible. Okay, Anssi, how much
Yes.
time do we have?
40 seconds left.
40 seconds
Yes.
left, okay. And after that, Amanda, Osmo will continue the chest compressions for a while, and you can feel the pulse during the analyzing.
I could take care of the medications after this.
Okay. I think we're going to do a rhythm check. So Osmo, get ready. Stop compressions. Do we have a pulse?
There's no pulse.
There's no pulse. Start compressions. Okay. We have something which is to be pulseless electrical activity. So that's a non-checkable rhythm. Amanda, let's change the person doing compressions. So 5, 4, 3, 2, 1, change. Thank you. Anssi, we
Yes.
have PEA just there, so could you please administer 1 milligram of adrenaline?
1 milligram adrenaline.
Yeah, thank you.
1 milligram adrenaline.
1 milligram of adrenaline.
Yes.
Gone, okay. Thank you. Does the team have any ideas here? Are we looking for something? Are you satisfied?
Well, I think the embolus is pretty probable
Yeah,
at this
yeah.
stage.
Pulmonary embolism,
Yes.
that could be, or something in her heart.
yeah.
Okay. Well, we're going to take the next rhythm check and see how the situation is after
okay.
that. And you're taking care of the time.
Yes.
Okay, thank you. Do we have the capnograph reading? What does it
It's
say?
20.
In kilopascals.
Kilopascals, 2.3.
2.3. Okay, thank you. So Amanda, capnograph is 2.3, so that seems pretty okay. Chest compressions, thank you. And Osmo, during the next rhythm check, please feel for the pulse.
30 seconds.
30 seconds.
I continue.
Yes, you can continue the compressions after the rhythm check if necessary.
10 seconds.
10 seconds. Okay, Osmo, get ready. Okay, Amanda, stop compressions. Do we have a pulse?
Yes, there is a pulse.
There's a pulse, okay. Amanda, can you move a little bit? And I can feel a pulse.
There's no breathing, but there is a pulse.
No breathing, but there's pulse. Okay, we have ROSC, so return of spontaneous circulation. Thank you. Okay, let's start the post-resuscitation care using the ABCDE method, and after that we're gonna take care where we're gonna move Donna next probably to the ICU, so we will let them know to get ready for her. Okay. Let's start with the A. Intubated, we have intubated her.
Patient has been intubated and air goes in.
Okay, air goes in. There's no problem with the intubation and ventilation.
So she's tolerating the tube, and there is equal bilateral movement of the chest wall.
Okay, so that's A seems to be okay at this time. Okay, let's move to the B. Amanda, if you can please attach the pulse oximetry.
Yes,
And we have the capnograph there. And what does the capnograph say at this time?
So capnograph says 4.8.
4.8. Okay, thank you. And Timo, please adjust the ventilation so that we are normal ventilating him. So somewhere between 4, 5.5, between there. So adjust it.
5.5.
Yes, okay. And 100% oxygen at this time. Let's see how the SpO2 looks like.
So with the probe peripherally, you can't get a trace.
Okay, we can't get a
There's
trace.
no trace.
Okay, no trace. So we're using the 100% oxygen at this time until we get the blood gas samples from artery, since we don't know
Okay,
that.
we'll take the 100% oxygen.
Yes, thank you. And we're going to consider the positive end expiratory pressure in a while once we see the hemodynamics. Osmo, can you please check the patient's chest if the patient's chest is moving kind of normally and is Is
With
there any
each- with
trachea?
each ventilation, the chest wall moves normally.
Okay, is there any trachea deviation? How about the vena jugularis? Are they full, or can we say that?
They're not particularly elevated.
Not particularly elevated. Okay. Is there any crepitation?
No.
Okay, nothing like that. Okay. And Asmo, can you please listen to the breathing sounds once more?
Yeah.
Okay.
Normal bilateral breath sounds.
Normal bilateral breathing sounds. Okay. You happy with the B?
Yeah.
Okay, for now. And let's move to the C. Can we get a ECG reading? There seems to be a sinus rhythm with a rate of 80 at this time. Can you get blood pressure for us?
Blood pressure meter.
Non-invasive blood pressure. Okay.
90/40.
90/40. Okay. So that's a bit low. We're gonna aim for systolic to be above 100.
Yeah, if I raise the legs and give
Asmo, yeah, Anssi, if you can please raise the legs, start with that, and we're gonna continue the ringer infusion, and at least 500 milliliters to
I'll
go.
put a chair under his.
Yeah, okay, you'll put something under that. Okay, thank you. And Anssi, can you please get ready if we need something, noradrenaline, for example, if you can get a infusion ready.
Okay, noradrenaline
If we
infusion
can't
ready.
control the pressures with the fluids. Okay. Asmo, can you please check the skin? How does the skin feel?
She's cool peripherally.
Cool, preferably.
Reasonably
Okay.
warm centrally.
How about the capillary refill time?
5 seconds.
5 seconds. Okay, so that's a bit long, but that's something that we would suggest. And there were no major bleedings anywhere that
Nothing
we
obvious.
can see. Okay. Okay. And can we get blood pressure every 2 minutes, if
Okay,
possible?
every 2 minutes.
I have the noradrenaline ready.
You have that
Yeah.
ready. Okay, so we're treating the
needed.
low blood pressure. And Amanda, we're gonna get an EKG. So if you can get that ready, but
Ready
not now.
for EKG. Okay.
Yeah, 20 minutes after the ROSC, so in about 15 minutes or
Okay.
so. Yeah, okay.
Okay, I'm going to bring the scenario to an end there. If you'd
Okay.
like to join me in a round of applause.
Okay, thank you.
Guys, could you get the mannequin back onto the bed for me?
Okay, thank you. Okay,
So thank you, guys.
thank you.
Thank you.
All of you guys. Yeah. Are you satisfied?
Yes.
I think more or less. Yeah, yeah. There were something that we didn't assume. The equipment were a bit different that we assumed, but
Okay.
yeah, that's life.
You were sort of, why were you not totally satisfied?
Because the equipment was something we haven't used, but otherwise I think it went well.
Okay. So you had a problem with the pads
Yes.
in the beginning.
Yeah, yeah, we had a, yeah.
Do you know what was the problem?
It just it was maybe some difficulties with the connection.
No, it was actually that it was too far down.
Okay.
That
Okay.
the mannequin detects where you put it, so it should have been a little bit further up. So that was actually the problem.
Okay.
Yeah. Okay. But you managed to try and find the cause, I think,
Yes, and I think we
and were
found it
very
quite
attentive of it.
Yeah.
Yeah. Okay. Otherwise, everything went smooth. That's a
Yeah,
question.
I think yeah, more or less.
Yeah, I think so.
Yes. And why did it go so smooth?
Well, I think we have trained quite a bit for this, so
Yeah.
we have a good team and we have worked together.
Yeah. And what's good with the team? Why are you so good?
Well, we have our own roles, like we have discussed. We have a good leader, and everyone has their own job, what to do.
Yeah. So you knew exactly
very organized.
what to do. It was really, really organized. The team leader was stepping back and only giving orders. But you were also doing more than giving orders. You also asked the team for input.
Yeah.
So I think you included them quite a lot and informed you as well.
Yes.
So you all knew what was the problem here, so that you can better work together and give ideas. I think that was very obvious to me,
Yeah, yeah.
that you actually used all your resources here.
Yeah.
So even if you had not found the cause, you would get some input.
Yeah. Yeah.
Yeah.
Exactly.
Yeah,
Yeah.
yeah. Okay. Did you miss anything else?
Well, when we got the no, only about the stuff because the kit was a bit different than we
Yeah.
had used to.
Yeah, that's the problem, isn't it?
Yeah.
But sometimes you get spare equipment in the hospital that you don't know, so you need to know how to deal with that, I think.
Yeah.
Yeah, and the situation is same for all of the teams, so
Yeah.
Yeah.
the same
It is.
equipment either ways.
Yeah.
Yeah, we did a quick decision in the kind of before we started that we were going to do the CPR on the bed, but then it seemed that it was something that was kind of we were not familiar with the beds and seemed a bit hard. Then we are a pre-hospital team, so we decided to
So
take
you
her to the
like
floor.
to have the patient on the
Yeah,
floor.
Yeah, exactly.
So it's a hard floor.
Yeah.
Yeah.
And that worked very well, didn't
Yeah.
it? Yeah.
Yeah.
One small thing, you noticed that your tentative diagnosis was pulmonary embolism because of her previous history and her chest pain, and that
Yeah.
was absolutely right. But what about the post-resuscitation care then? Did you find where the pulmonary embolism came from?
I don't think that we got really that far probably in the post.
No, I
post-resuscitation
just
care.
noticed that
Yeah.
she still had her pants on, so you did not
Yeah.
fully expose her
Yeah,
to
exactly.
look at
That
her
would be
all
in
the
the
way
E
through.
parts. Yeah. So if there were something in her legs, for example, that we
Yes.
could see swellings
Yeah.
or anything like that.
Yeah.
Yeah.
And then you voiced that she was going to ICU and
Yeah.
receiving care there, and what would that care be, you think?
Well, probably some anticoagulants, some kind of a treatment for that, and see how her situation
Yeah.
develops from
Yeah.
there. So.
And then also what they would all do, and I didn't hear it, maybe you said temperature control, I don't know if you said that.
Yeah, we were kind of we were in the sea when we kind of stepped down. So
Yeah.
but it would have come
It's coming,
Okay.
but
from
Yeah.
the east. So from
Okay.
temperature. Yeah.
Okay, excellent job. I can
Okay.
only say that. Thank
Okay.
you so much.
Thank you.
Last but not least today, we've got last year's winners representing Malta. Please give them a big round of applause.
Hello. Up there?
Hi.
Hey. All right, Chris. All right.
Yeah, there we go. Hi, who's team leader?
Petra.
Hello, nice to meet you.
Hi.
I'm going to give you a scenario. I'm going to ask you to repeat it back to me so that I know that you've understood it.
Okay.
I'll then ask you if you're ready, and when you say yes, that will be the beginning of your scenario.
Okay. Will I have time to prepare my team?
If that's what you want to do, yes.
Okay. And can we have a quick look at the bed?
I'll give you 1 minute to do that.
Thank you. Have a quick look at the bed. Yep.
M'hemmx għalfejn dik in-naħa, tista' tiġi minn din naħa.
Jien minn din naħa.
Anke inti ejja minn din naħa.
Ija, mela.
Dik l-ewwel. Mela, 1, 2, dik.
Okay.
Okay. Good. Happy?
Yes.
The brakes on.
Happy?
Yes.
Ready?
Ħroġhom bil-left,
Ready?
Madonna.
So,
Yes.
you are asked to see Donna. She's 60 years old.
Okay.
She comes to hospital complaining of chest pain.
Okay.
Okay? It came on suddenly and is on the right side of her chest.
Okay.
She has been treated in the past for breast cancer with tamoxifen.
Okay.
Repeat that back to me, please.
So Donna is 60 years old.
Correct.
She's come to hospital complaining of a right-sided chest pain. She has
And shortness of breath.
and shortness of breath, which was sudden in onset. She has a history of breast cancer for which she's on tamoxifen.
Correct. Are you ready to start?
Are we ready to start?
Yes.
Sign Rose.
Please do.
Okay. Safe to approach?
It is safe.
Donna? Donna?
There's no response.
There's no response. Team, you're all here, yes? Anything in the airway?
Nothing.
Okay. Any signs of life?
You see no chest wall movement. You don't feel a pulse.
Okay, let's put the patient down and we start chest compressions. Very good.
8, 9.
Thank you. We'll do 30 is to 2.
13, 14.
Marius, please let me know when the defib is attached.
20, 21, 22,
27, 28, 29, 30.
1, 2.
Chris, stop. Start. We have VF. Marius, can you please shock at 200 joules?
Stand clear, shock the device continue.
Okay, so that was the first shock. Marius, can you please try and get IV access on this patient?
Oscar,
Yes, thank you. Take some bloods. If you can, take a full blood count, renal profile, cardiac markers, and a VBG, please. Let me know when that's done. Okay.
To the 8, 29, 30. Go.
Continuous.
Tanya.
Continuous.
Ah, yes.
Okay. Anne-Marie.
IV access in.
Thank you, Thank you, Marius. Anne-Marie, do we have a tube?
We have an endotracheal tube. We need to attach capnography.
Yes.
Very
Can we please
asynchronous.
have a capnograph?
Capnography is attached.
It's attached.
And we've changed to asynchronous.
Okay, very good. Thank you, Anne-Marie. So you have the tube, you are attached to 100% oxygen, correct?
Yes.
Tanya? Okay, good.
You need to tie the tube. You need to
Okay, so the bloods and the VBG have been sent. Very
Did
good.
you get feedback about the chest time?
Yes, 30 seconds to rhythm check.
Okay, do we have feedback on auscultation of the chest with the tube inside?
Equal bilateral air entry.
We have equal bilateral air entry, guys, okay? Excellent.
Okay.
Good. So we have about 10.
So 5 seconds to rhythm check.
Okay.
10 seconds, sorry. My finger is on the pulse.
Okay. So we
5, 4, 3, 2, 1, stop.
start. We have VF. Chris, can you please give the second shock at
Yes.
360
I'm charging at
joules?
360. We've got a closed circuit. Of the chest. Sorry, stay there. Of the chest.
Clear.
Shock delivered.
Okay, Chris, that was the second shock.
Yes.
Can you please prepare 1 milligram of adrenaline and 300 of amiodarone to give if we need a third shock?
Yes.
Just prepare.
Okay.
Tanya, can you take a temperature, please? So hypoxia we are dealing with. We have sent off a venous gas for electrolytes. Do we have any results?
Not back yet.
Not back yet. Okay. Tanya's taking a temperature. Do we have a temperature?
36.5.
36.5. Chris,
The adrenaline, amiodarone, and flush are prepared there should we need them.
excellent. Can you
Thanks.
please set up a liter of Hartmann's running as a bolus?
I will do that.
Thank you very much. Anne-Marie, are you still okay with the chest?
Okay.
Are we still okay? With auscultation and trachea in the
It's
center?
unchanged. Trachea is central.
Okay. Difficult to ventilate?
No.
Okay, so no signs of attention pneumothorax. Chris,
The IVI of 500 liters saline is up and running.
500 mils.
Mils,
Excellent.
yes. That bad.
Okay, can you kindly call cardiology to see if we can get an echocardiogram to exclude a tamponade?
Okay.
Tanya, you're free. Can you please double check if there are any staff or any relatives that can give us a history? Thank you.
Cardiology, we've got a resus ongoing, cardiac arrest, and we need an echo to exclude cardiac tamponade. Thank you very much.
Do you have information, Tanya? Okay. Okay, so no additional history of toxins, okay? No additional history. Tanya, can you just double check the legs for signs of thrombosis? The pelvis and the abdomen while you're at it, please.
Check the urethra and rectum for blood.
Any
Nothing
findings?
obvious.
Okay, no findings on exposure of the limbs. Okay. How are we with rhythm check, Anne-Marie?
15 seconds.
15 seconds to rhythm check, team.
10 seconds. My finger is on the pulse.
Okay, thank you, Anne.
5, 4, 3, 2, 1, stop.
Start. Just a second. Stop a second, Chris. Do we have a pulse?
There's no pulse.
No pulse. Continue chest compressions. Okay. We are now in PEA. Can you please give the 1 milligram of IV adrenaline, Tanya? Let me know when that's done with a flush, please.
The left calf is swollen.
Okay. We have new findings. The left calf is swollen. So probably signs of a DVT. So we are now thinking that this could be a PE, right? So a thrombosis from the leg going up on a history of breast cancer.
Yes.
Tanya. Adrenaline given first dose. Thank you very much. So we've done the H's, we've done the T's, and we're thinking this is thrombosis. So
need to start the
PE
protocol.
probably. Should we be thinking of thrombolysis? Yes?
Yes.
Okay, Tanya, please double check the doses. so that we can start giving thrombolysis, please. Okay.
Yes, okay. Thanks, Maurice.
Are you guys okay? You're free. Can you check on the VBGs for me because they have not come back?
And glucose.
Potassium is 5, glucose is 4.5.
Okay. Do we have a lactate and a hemoglobin? 6?
6. Hemoglobin's normal.
Hemoglobin's normal. Okay, so the abnormality is a lactate of 6 and potassium of 5. So we don't need to do anything about the potassium per se. Thrombolysis? Okay, do we have IV access that's good enough to give thrombolysis? Okay, perfect. Good. Chris, you're okay with the compressions? Perfect.
Yes, another cannula won't harm.
Another cannula can be taped to the other side, please. Thank you. All right. It's okay. You will be changing Chris soon. Yeah? Give a break. Thank you, Tanya. Okay, so that's our H's and T's, and we have a rhythm check, Anne-Marie, soon.
Yes, 10 seconds to rhythm check. My finger is on the pulse. 5, 4, 3, 2, 1, stop.
Yes, there is
Do we have a
pulse?
pulse?
Yes.
We have a pulse. Okay, team, we have ROSC. Can we put all the monitoring on, and let's start an ABCDE. So, Anne-Marie, airway. Do we have a tube?
So we have a size 7 tube in place.
SpO2 is on.
It's at 22 centimeters at the lips.
Okay.
And I'm seeing the chest rise.
Okay. Is the patient fighting the tube?
Patient is tolerating the tube.
Tolerating the tube. Okay, thank you. Anne-Marie, make sure you have capnography, please. Let's start with B. The pulse oximeter has been attached.
There's no signal.
No signal. Chris, when Chris auscultates?
Equal normal air entry.
Equal normal air entry. Can you do chest expansion and percussion?
Normal and equal.
Normal and
as
equal.
is percussion.
Okay.
Okay. Is there any ventilatory effort?
None.
No. Anne-Marie, will you please keep ventilating?
I will.
Okay. We're going to move on to C, yes?
5 seconds.
CRT is delayed, okay. The heart rate is as the monitor.
It is.
104, and a blood pressure cuff has been attached.
Yes.
Chris,
And keep your finger on the pulse, please.
okay?
Nice.
90 over 40.
90 over 40. Has the first fluid gone in?
Yes.
Okay, can we start a second fluid, please? Thank you very much. Hartmann's, another 500 mils would be great. Thank you. Can we check peripheral and central pulses, Chris?
Yes, okay.
Peripheral pulse
Attached.
is barely palpable. Central pulse is present.
Okay. Is there any cold level? Cold and clammy peripherals?
About the elbow.
Above the elbow. Okay. Anything in the abdomen?
It's soft.
Soft. Can we please have an NG tube?
Yes.
Thank you, Anne-Marie. And Marius, can you put a catheter in? Yes. Chris?
Chest X-ray, ECG.
Yes. Can you please call a chest X-ray and an ECG? Perfect. Now we can do D. Anne-Marie,
Right, I forgot
can you have a
again
look at the
with
pupils,
the
please?
CPR, we have
Yes.
return of spontaneous circulation.
Okay.
We need a chest X-ray and ECG. Thank you.
The pupils are?
About 4 millimeters and reacting to
And
light.
reacting to light.
Equal.
Chris,
Our chest X-ray and ECG on the way.
On the way.
chest X-ray ECG on the way. Chris, can you check for a response to pain, please?
Okay.
Urinary catheter in. Thank you very much.
No response.
No
pain.
response to pain. NG tube in, catheter in. Perfect. Okay. Now exposure. Can we just make sure down below again? Is there anything that we need to know except for the leg?
New. Nothing new.
Nothing new on exposure. Can we please expose the back together just to make sure that we're happy? We can log roll just in case. Okay. Anne-Marie, over to you.
So on my 3, we turn towards you guys. 1, 2, 3.
Thank you. Anything in the back?
Nothing to see.
Rectal
Nothing
exam.
abnormal.
Okay.
On my
Back to
3,
you.
back supine. 1, 2, 3.
Okay, very good. So we have an ECG on the way, a chest X-ray on the way. The thrombolysis is going in. The NG tube is in. Chris?
I've rechecked pulse and I've rechecked the chest and the air.
Unchanged.
Unchanged. Okay.
And the trachea.
Okay, so we're going to need intensive care for this patient because with the thrombolysis and the history, then she should be going there.
I understand.
Anything else, team, from your end? Chris?
Is the thrombolysis going in?
Yes, thrombolysis is going in.
Everything is secured, the venous access is fine.
So we are ready to transfer?
Yeah.
Yes,
I'd
and
like to know the capnography reading.
capnography reading for a pulse.
It's 4.8.
Okay, that's within normal range. Anything else to add, Dan? No. Tanya?
Any problems with head or any head
No.
injuries?
No.
No signs of
I'm
head injury.
rechecking again.
And I'm
Okay.
going to bring the scenario to a close. If you'd like to join me in a round of applause.
So thank you so much.
Thank you.
Thank you.
You're sweating a little bit. Yeah, you did quite a good job,
Okay.
I think.
Thank you.
What do you think?
I think I agree with you. I think I had an excellent team.
Yeah.
And we worked very well together. I think we spoke to each other a lot.
Yeah.
And we followed the algorithm.
Yeah, I think you did too. So you say an excellent team, you spoke with each other. What more made it an excellent team?
I mean, we were constantly updating each other, and there were some new findings. I mean, it's the way we spoke to the team leader. She listened to us. She made us feel part of the team, and she always had a good idea of what's going on, and listened to our bits of information as we got them.
Yeah. So you were very attentive. Also noticed that you, when you had your hands in the air to say something, and you didn't actually interrupt each other. I was quite impressed about that. The what you call that? That you waited for each other and so on. So that was really good, I think. I also noticed that you said, okay, I'm free, I have hands free, what do you want me to do? So that you could all the time put people to work.
Yes.
Yeah. Did you encounter any problems?
I did at one point. I was unsure of the rhythm. I initially thought it was a VF, and the team drew my attention to that very, very quickly.
Yeah.
So we stopped and rechecked a pulse. There was no pulse. So the correct thing to do was still chest compressions, but we did not need to defibrillate. So that was a sign of great teamwork. So thank you.
And so how many seconds do you think that took?
I have no idea.
No, I didn't look at my watch, but I mean it was
We stopped
2,
twice,
3,
but-
maybe 4 seconds.
I think
so
they-
that
yeah.
you really minimized the pauses by being so attentive, all of you, all the
I
time.
had a great timekeeper, a great voice.
Keeping the 2 minutes
Yeah.
for us.
Yeah.
We were all aware of what's going to
And
come
so
up.
you have obviously been rehearsing this quite a lot, because the countdown was made it, I think, that was one of the things I haven't seen before, and it made the pauses so short that, well, I haven't seen the figures, of course, so I don't know if they were the shortest, but I think it was really, really good. Yeah. But you need to train it to be able to do this. So do you train everyone this way?
We try.
In hospital?
We try.
Yes.
We
Yeah?
try, but
Okay.
So on our courses in Malta, yes, we try to emphasize that hands of the chest especially should be minimal.
So it doesn't matter so much who you're working with.
Exactly.
yes,
Okay.
it helps.
Then I don't mind having a cardiac arrest in Malta. I'm sure you will.
It's a good holiday destination.
Yeah. Okay. Any more questions, remarks from you?
Tanya?
No?
No.
Okay. Excellent job. Thank you
Thank
so
you.
much.
Thank you.
Thank you. Thank you.
I had a stethoscope.